So you want to open your own treatment center. We get this a lot. There are quite a few things to consider before, during, and after opening. Some of these include the type of program you want to create, what levels of care you want to offer, type of company you're going to form, the location or properties involved, where's your startup funding going to come from, how much service revenue are you going to get and where will it come from? What about your budget and income projections? There's licensing and accreditation, staffing, marketing, admissions, billing, vendors and contractors, and strategic planning. We'll take a look at all of these briefly throughout this presentation. When you think of what type of program you want to start, it's helpful to go with who's your ideal client or patient. This goes in the realm of what are the primary disorders you want to treat? Are they substance use, mental health, both? Are there any specialty areas you want to focus on? What type of therapeutic approaches are you going to use? These could include things like DBT, CBT, EMDR, MAT, and there's a whole host of other therapies and acronyms that we could go through. What about other adjunct services you're going to offer? What kind of aftercare will you provide? You also have to consider the levels of care. Certainly in substance use, this can include detox, residential, PHP, IOP, and OP. And if you're doing outpatient only, do you still want to offer housing of some type? Or are you going to do a combination of two or more of these, potentially all the above? So depending on some of the earlier questions, what type of company do you want to form? Are you going to be a nonprofit or for-profit? If the latter, are you going to start with an LLC or potentially a C Corp? Of course, you want to seek the advice of a tax attorney or an accountant if you have any legal questions in that regard. So location and property hunting is a difficult part of this process and also very strategic. So depending on what level or levels of care you're going to offer, that can include, are you going to lease or purchase the property? Do you want it to be accessible, such as within a certain driving distance or time period on the road? Or do you want to be more secluded if you're offering a residential facility in a more retreat type setting? What kind of renovations are going to be needed? Or are you going to build from the ground up possibly? And when looking at all that, go through the space planning and see, how is this going to be used? And is there room for growth? As your vision starts to come alive, you're going to have to take a look at, where's your startup funding going to come from? Is this going to be a bootstrap project where you're going to self-fund the whole way? Maybe approach friends and family for assistance. What other kind of partnerships might be available? Can you go more of a traditional lending route through your bank? What about private equity? Or are there other combinations and resources or some mixture of one or more of these? What about your sources of ongoing revenue? Is it going to be through donations, grants, cash pay clients or patients? What about accessing public funding, such as Medicaid? Or are you going to go with a more traditional commercial insurance route? As you go through your budgeting and revenue projections, you got to take a look at your first year, your startup, and beyond. And for the income projections, you're going to have to take things into consideration, such as your number of admissions, potentially what your average daily census will be like. What kind of revenue can you expect per service or per level of care? Or is it going to be based more on a per day or per unit rate? And lastly, there's also variations per payer or contract that you may be under. For your expenses, some of the places that you'll naturally look at are, first of all, your startup costs, and then your ongoing things such as your rent or mortgage, utilities, staff, maintenance, vendors and professional services, liability insurance, and quite a bit more. For your licensing and accreditation, first of all, of course, you're going to need a state license, typically for each level of care you're going to provide. And most states are also required to be able to get a national accreditation, either through CARF or Joint Commission. And even if it's not required, it's still a good idea and considered best practice in most areas. To do so, you've got a lot of paperwork and compliance issues to deal with, such as starting off with your policy procedure manual, your client handbook, your employee handbook, and a whole host of other things. When it comes to staffing and scheduling, there are three main areas that you're going to have to take a look at. First is your medical area, such as your doctor, your nurse practitioner, or physician assistant, your registered nurse or licensed practical nurse, and what are the needs of each of these. There's also your clinical area. This is really your therapists and counselors, and they provide the bulk of the services that you're delivering. And then there's also the administrative and support staff. When you're taking a look at scheduling, you want to look at what is the best use of each of their time so that you can provide the best services possible and be the most efficient with your employee costs. As you're continuing to go, you're going to have to let people know that you exist. And this is an ongoing process. Marketing is not a one-time thing. Some of the most common areas of marketing include online or digital marketing, such as your web development, your search engine optimization, pay-per-click advertising, social media, and other potentially directory listings. There's also your in-person or business development and clinical outreach stuff, your networking with other facilities, therapists, doctors, hospitals, companies, for their HR department. Maybe they have employees who would be perfect for your services. There's also other channels such as sponsorships, partnerships, events, and other media. As people continue to learn that you are there and about the services you offer, you're going to get inbound inquiries, people who are interested and need help. And frankly, admissions is one of the biggest areas of struggle for a lot of facilities out there. And that's, how do you effectively handle incoming inquiries? How do you properly communicate about your program? How do you go through the pre-qualifying process for compatibility and be able to cover scheduling and associated costs and financial responsibilities? Admissions is one of our specialties, and we actually work with quite a few programs in this area alone, not just from the startup process, but those who are needing help to be able to get more of their inquiries converted into admissions. Once you get clients or patients, you have to figure out how to bill to receive money. Are you going to do this in-house, or are you going to outsource it? Some of the steps involved in billing include your verification of benefits. What kind of pre-authorizations are needed? You have to submit the claims themselves. Got to go through utilization review and be able to get additional days covered. How do you go through collections once claims have been submitted, and also collections on copays and other payments due from the patient? And part of this whole process is whether or not you're going to go in network with various payers, how to be able to do the contracting, and how to be able to get the best rates possible for the services that you're going to be providing. Some of the vendors and contractors you may need could include licensing and accreditation people and compliance assistants, because you'll have ongoing inspections and surveys to maintain these licenses and accreditations. You'll need a liability insurance provider for your professional coverage. What about your electronic records, your EMRs, EHRs? How are you going to keep track of all of this? And are you going to use some type of CRM or customer relations management system? A lot of times these can be integrated. What about your labs that you're going to use? Or, as we mentioned in the previous one, billing, revenue cycle management. What about your marketing agency for your digital marketing, your web development, and other places? And your payroll and human resources. There's quite a few other vendors and contractors you may come across as well. And lastly, your strategic planning. Not only starting with your opening market entry, but what is your growth model? Are you going to stick with a single location where you add more space or levels of care? Are you going to wind up going with multiple locations, or potentially both? And lastly, what is your exit strategy, if you have one? Are you going to hang on to this forever until you retire and pass it on down through your family? Are you going to wind up merging with another company or provider, or potentially being acquired through a private equity firm, or some other behavioral health company out there who's looking to grow. If you're looking for help with any of this, feel free to contact us anytime for a free consultation, how we might be able to assist you through the process of taking your vision from a concept into reality. You can reach out anytime by emailing info@advancedrecoveryresources.com or through the contact form at advancedrecoveryresources.com.